This is episode 162 of Stand Up. Joining me today, Dr. Craig Spencer and April Rain. I'm Pete Dominic. Time to stand up with me right now. Hello and happy Monday to you. I hope you had a good weekend. And to all of you who listen to this podcast almost every day, in the morning especially, as you go on your walks and your runs and your rides and your whatever you're doing, thank you. Thank you very much. You know who you are. I hear it from so many of you that you listen to the podcast during your morning commute or walk or whatever you're doing. And I am so honored and happy to be along with you. So thank you very much. Thank you to all of the new subscribers as well. Several new people subscribing in the last week. And I'm going to give some shout outs today on this episode of the podcast. I hope that you had a good weekend. I know not everybody has their weekend on Saturday and Sunday, but those of you that did, I hope it was good. Those of you listening chronologically, at least, it's Monday. It is the 10th of August, and there is a lot happening, as there always is, in our crazy, crazy, insane world and life. How are you doing? How are you doing? I'm always kind of seemingly up and down. I feel like some days, like, that I'm bipolar, but I know I'm not bipolar, but I've just heard about that, and it just seems like ebbs and flows throughout my day of highs and lows and happiness, and it's very hard for me to get in a routine, and I think any kind of scheduled routine is a healthy thing. How are you doing with that? Are you struggling with that at all? Do you do the same things around the same time every day? I don't think I'm ever going to be able to achieve that, which is not a terrible thing, but it makes things a little bit more challenging to not know exactly what's coming. And I'm excited because the studio is really coming along. We've got it painted and spackled and sanded. Well, at least the beginnings of that. It's going to be finished up early this week. My neighbor, who's out of work and is a painter, I gave him a few bucks, and he's going to do that for me. So I'm really excited about that as well. Had a great show on Saturday night. Did my first stand-up comedy live in front of an audience since March, and thank you to everybody down at Soul Joel's Comedy Club in Royersford, Pennsylvania. Several listeners came out. Hi to Kitty, hi to Dave, hi to Steve and his girlfriend. Really great to meet you guys in person. It sucked that we couldn't hug and hang out longer, but I so appreciate you coming. It was super weird to be doing stand-up outside, but I think it went really well. I'm going to cut out some of the best parts and share it here on the podcast and social media as well. As we begin the week, we are still without a deal for Congress and the president in terms of benefits, unemployment benefits, and debt relief, and rent and eviction relief. President on Saturday announced this weird executive action that is supposed to extend economic aid to Americans while Congress is in this stalemate. But who knows? The effectiveness and legality of these measures that he signed are unclear, according to the New York Times and pretty much every other news outlet and political analyst. The orders seem to exceed constitutional limits on executive power. This is, Congress has to approve of spending in this way, and he unilaterally continued expanded unemployment benefits at $400 a week rather than the previous $600 a week, which, of course, Democrats are fighting for, along with a bunch of other things. And he also signed orders intended to. Does it really matter? It doesn't matter what he signed because it's not going anywhere. He did it in front of a bunch of his stupid members at his stupid golf club in Bedminster, New Jersey. And so hopefully we'll get a deal. But Nancy Pelosi's in charge and has a lot of momentum. And I think that she's going to wield that power effectively. I hope, at least. I'm rooting for her and the Democrats to give a package to Americans that actually is going to make a difference and allow them to survive. I mean, people are struggling. It's been 2 weeks now where they're not getting paid. Hopefully, whatever they sign will be retroactive as well, so you'll get back unemployment paid. Anyway, the United States now nearing 5 million confirmed coronavirus cases. Deaths are over 162,000, although some analysts and experts think they are actually, the real deaths are over 200,000. Our country continues to lead the world in both categories and accounts for about a quarter of global cases. Way to go. That's American exceptionalism for you. The pandemic remains a serious problem in a whole bunch of states across the country. Apparently, Arizona and Florida have seen some encouraging signs of improvement thanks to renewed lockdown measures. Brazil, now the second country after the U.S. to reach the grim milestone of 100,000 confirmed coronavirus deaths. There's a lot there on the economy and on the pandemic, and there is no sign of it ending anytime soon. So buckle in, strap in, and prepare for this to be our new normal for a while, maybe for a long while. I am going to keep doing this podcast every morning. I'm going to keep talking to you. I'm going to keep talking to the best experts I can find and communicating with you. I'm going to keep hosting these hangouts to try to keep everybody sane, including myself. I really appreciate your support. I could not do this without you. I have 667 paid subscribers as of Sunday night at 9. And I want to thank a whole bunch of you that have just signed up. A lot of you have edited your subscriptions up from $5 to $10 or $10 to $25 or more. That's a big deal. But in the last 2 weeks, I just want to thank a few people, and you can fast forward if you don't want to hear, but I want to give shout outs to new subscribers at patreon.com/Pete Dominic. Brian Rennie, $5 subscription. Sam Wickstead, $5 subscription. Antoine Miller, welcome to you, $5. Maureen Murphy. I went to high school with a woman named Maureen Murphy. I wonder if that's her. $5 subscription. I don't think it is. David St. Lawrence, $5 subscription. Kurt Gamlin, $10 patron. Kevin Beisch, is that how you say your name, Kevin? $10 subscription. One of my idols and one of the most important writers in my life, Richard Louvre, the nature writer, has subscribed to the podcast for $5. Thank you, Rich Louvre. Glenn Robb, who was joining us the other night, who looks like Louis C.K. but doesn't act like him, $5. Art Kaplan, $10. He's a regular listener, the most respected, regular guest, I should say, most respected bioethicist in the country. I'm going to go ahead and say Art Kaplan, a subscriber like you. Sean F. just became a $5 subscriber. John Capolino, $5. Chase Connor, Mark Casilli, $10. Jennifer Wallace, $10. Craig Duff, a $5 patron. Claire Holland, $10. Charlie Naney, $5. Cameron Gabbs, $5. Nancy Wind is a $10 patron. Kitty, who came to my show the other night, $50 a month. Kitty, thank you so much. I'm so excited to have you in my life, and to have met you the other night was really cool. Ian Van Kirk, a longtime listener, $10 subscriber. Lucas Carter, $10 subscriber. Beverly Jackson, $10 from Beverly Jackson a month. John Campanelli, my old friend John Campanelli, good to see your name pop up, and part of our community. $5 from John. John Purifoy just became a $10 subscriber. Jeremy Rogers, $10. Glenda Rogers, $10. Hey, the Rogers family. They have to be a couple, right? Or family. Nina Piper, a $10 subscriber. Matt B, $5. And Stephen Courtney, $10 subscriber as well. I know that I've missed people and haven't given everybody a shout out. It's one of the things that's hard to keep up with. I would like to reach out to each one of you personally and thank you, but this is as close as I'm getting tonight. But I will hopefully connect with you some way, somehow, and I cannot thank you enough for your support. 667 subscribers. My goal is to get 3,000 subscribers. That way we can hopefully hire more help and do an even better job here with the show, with the booking, with the promotion, with the editing, and all of the things which I currently am doing myself right now. Every day we put this podcast out. I put this podcast out. I don't know why I keep saying we, but I'm thinking of all of you listening. So thanks to all of the new subscribers, and I don't know what to say. It's so moving to be a part of this community with you, to build this community, and if you've got ideas as to how we can create better platforms to communicate, to connect with each other, I am waiting. Email me, standupwithpete@gmail.com. Okay, let's get to my first guest. I had an hour conversation or so with April Rain, which I'm really happy to share with you. That is coming up, and I hope that you'll listen to that. But before that, I talked with Dr. Craig Spencer, for about half an hour or so on Friday, and we covered a lot of ground. He's a great guy, great sense of humor, and guess who one of his biggest fans is? Barack Obama. Yeah, that one, President Obama. I talked with him a little bit about that at the top here, and much more that you're going to want to know. Dr. Craig Spencer joins me now. I don't come to your job and take the doctor tools out of your hands.
That's true. You don't. Don't do that. Don't do that. People are already basically trying to do that. So, yeah.
How limited my understanding of what you do is. I couldn't even come up with a tool that you would... Stethoscope.
It's true. Otoscope. The stethoscope isn't actually super helpful to us anymore. It's really the ultrasound. The stethoscope is signaling. It's like, hey, I'm a doctor. The ultrasound is I'm being a doctor. So
the other thing that's signaling is our scrubs, the outfit that you wear. And what I learned when my wife was giving birth to our first daughter was that everybody who works in hospital wears them. It's not just physicians or nurses. And I learned that in an uncomfortable way when a man came into the room that my wife was in, and my wife was in labor or at the beginnings of it. And she was in a lot of pain. And I asked him to take a look to see how dilated she was. And I'll never forget it. He literally said to me, this isn't a joke. He said, I'm just here to take out the garbage, sir.
But I mean, I don't mind. I'll take a look. That'll help him.
He was not interested in taking a look, believe it or not.
No, I think the garbage truck has already passed for the day. I think we're good. There may be some reggaeton in the background at some point.
I'm not okay with it. I lived in a neighborhood in New York where I was introduced to reggaeton, and I'm culturally, ignorant, of course, but I also, I don't like the way it sounds in my life. I don't like that music. The pop, 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 pop. It sounds always the same to me, but I should never be talking about or weighing in on music because my ignorance knows no boundaries. How long do you have?
As long as we need. As short as it'll take and as long as we need.
We'll go till.
I'm going to take a nap. I'm working tonight.
We'll go till. So we'll just go till whenever you have to leave for work.
Yeah, so it's about 8. So about
6 hours.
We'll do a little dinner break, a little lunch break. I got food coming on the way. The sushi's being delivered now. So when that comes, I don't know. What did we chat last time? Like half hour or something?
I don't know. Yeah, something like that. We'll do probably 30 minutes or so. Give or take a few. Cool. I could talk to you forever. And I appreciate you joining me. And I have pressed record. Here we go. Are you ready?
Let's do it. I'm ready.
Okay. My first question to you is, when you volunteered to go fight Ebola in Africa, you then contracted Ebola and came back to the United States and became a national story for what you did and the fact that you actually got ill yourself. And the president at the time, President Barack Obama, called you, and in this week he tweeted you. And so you guys are good friends. What did he say to you?
In 2014 when we chatted?
Yes.
I think it was something about what I'm going to do and talking about a beer. I was in the hospital for 19 days. And even before that, I didn't want to drink. I'm a big beer fan. I make my own beer, big craft beer guy. But I wasn't drinking, obviously, in the hospital. You don't do that. But even before then, so I said, you know what? I'm so excited. I'm going to go out and I'm going to have a beer. And he wished that I had a good one. The problem, of course, was that the disease had destroyed my taste buds. So I opened up this really great double IPA, and it tasted like nothing. I didn't want to tell him that. I didn't give him that follow-up when we chatted a couple of weeks ago. But I appreciated the good, the well wishes in the call.
So you chatted again with him. He didn't just.
Yes.
Okay. Can you talk about? Do you mind tell me about how that happened? Sure.
They reached out around a month ago, just basically to follow up and say, hey, we chatted 5-6 years ago. I was at the White House in late 2015, early 2016 for an event. Got to briefly meet President Obama at that point, and it was really just hey, let's just check back in and talk to see what's going on. Earlier into the pandemic, late March, President Obama retweeted a thread that I had wrote about working in the emergency department. And that kind of made it go viral and crazy. And I got a bunch of media attention. And so I think that helped kind of amplify this public health voice. And what he was trying to do here, I think, is basically just say, hey, we need to listen to science. Hey, we need to talk to public health experts. And so basically we chatted for 20, 30 minutes around what role science needs to have, what role public health needs to have in fighting this pandemic and right now, and where is it, why don't we have it, and what can we be doing to make this much better.
How much that's pretty cool, man. It's got to be pretty cool to be talking to Barack Obama, President Obama.
It's listen,
do you guys DM?
I'm talking to Pete Dominic right now. It doesn't matter who it is. I'm happy to chat about this.
Close second, no doubt. I mean, I'm not gonna be self-deprecating. It is an honor for you to be talking to me for the second time.
Twice,
have you know. How do you feel about smart economists talking about public health issues on national television?
less of a problem with smart economists than I do with Peter Navarro talking about hydroxychloroquine on television. I mean, it's crazy. What makes me so angry is that for so many of the times that he has been on, I was scheduled to be on, but got canceled because they wanted to talk to an expert. And so
you were actually bumped by him?
I'm not sure if it was to make space for Peter Navarro, but I've definitely been bumped from programs at which Peter Navarro shows up and is talking nonsense about things that he has absolutely nothing opining about. Look, I said this the other day. If you want to hear about how I think Keynesian economics could have a microeconomic impact on our, some other microeconomic gibberish, like, I'm happy to chat with you. I'm happy to talk about 401ks, whatever. You should not listen to me, though. I have absolutely no idea around deficit spending. I don't know. So just it's frustrating because it takes up space on a program. It's disinformation. And it just means that when I go back on that program, when Peter Navarro is not available, apparently, I'm not talking about how we move forward. I'm talking again about correcting this ignorance and insanity that we've done so many times. So it just, that's
enraging to hear. Are there any other criticisms that you have about whether it be cable news or any other form of media and the way that they're mishandling this outside of the obvious conspiracy theory media, which is only becoming more popular?
Absolutely. It is. This is disinformation, or as the WHO calls it, it's an infodemic. Part of it is because we have so much information that's flooding in, right? Like every day there are hundreds of studies, and one study may look at something, and another study 2 days later may look at the exact same thing and come to different results. But what we're doing slowly is we're getting this growing body of evidence. And it's pretty amazing what we've been able to accomplish in the past 6 months, right? Like we didn't even know this virus existed, 8 months ago. So the fact that we have all of this information, we know about asymptomatic carriers, we know about aerosols, we know about the impact in pediatric populations, having a vaccine, therapeutics, like this is incredible. But at the same time, the incredible pace of scientific discovery has been challenged by the incredible pace of disinformation, and people aren't your experts saying, it's interesting. I actually read a summary of this study on someone's Facebook feed, and this is what I think. It's fine. Everyone should have an opinion. People need to be educated, but you have, cable news putting on people that shouldn't be talking. But the bigger problem is social media. The fact that Facebook won't stand up and say, this is lying. This is truly lying. And we've seen a little bit more of it recently. We've seen the willingness of things like, of Twitter to label things as misinformation or to suspend accounts briefly. But like, that is the biggest problem. Our biggest problem is fighting things that are very clearly untrue and are deliberate disinformation. That's the problem.
That is got to be so frustrating because, like you said, you would like to move forward and help people and put out the information that you is the best science, as opposed to spending your time combating disinformation. And that being said, I'm going to ask you to do that just to try to understand, because I really don't. I haven't paid much attention to it because I don't see the need. But what is the danger? This controversy about this drug, hydroxychloroquine, is interesting in a lot of ways. But the fact that it's being pushed by the president and by Peter Navarro and by some even like one or two scientists, who's that person at Yale, that guy. But
Newsweek, the guy in France.
What are the dangers? Like, I think Peter Navarro was saying, and I think the president said, like, what's the worst that can happen? I mean, which is preposterous, or, what do you have to lose? What is that drug actually for? What isn't it for, like malaria, and you take it before you go to a place? How does it? Are they saying that you should take it? Everybody should take it to prevent from getting COVID, or that if you get COVID, you should? I don't even know what they're suggesting. And why is there so much talk about this one drug?
Mm-hmm. Yeah, well, this has been, this is emblematic of amplifying the political over the public health. The president has, for some reason, decided this was his wonder drug early on. If you remember, at one point, he was not only pushing it, but said that he was taking it himself, which blew a lot of minds. Because, look, the reality is right now, and this is not me being anything other than some, nerd that reads studies and aggregates information and does what I need to do to share good public health information. The information and the science we have right now is that hydroxychloroquine, whether given alone or in combination with zinc or azithromycin or cotton candy, whether it's given early in the disease or late in the disease, it has no impact. It has no role in treating COVID-19. We know that right now. That being said, look, is there this unicorn possibility that 2 months later we're going to have randomized control studies that say for a certain population at a certain risk at a certain part of the disease, it has an impact or reduces mortality? Maybe. It's unlikely. We think it's unlikely. But I want to be clear. Look, I took care of hundreds and hundreds of patients that had COVID-19. I saw many of them die. We didn't have anything really to help them other than good quality clinical critical care. If the only medicine that worked in fighting COVID-19 was called Donald Trumpoquin and it was sold by Ivanka Industries, all of us would happily give it and pay, a 10,000% markup to give it, because it's not like we want to sit and watch people die. We're like, well, you know what? You could have had a chance, but I've got political beliefs that don't align. So, so much of that is pure craziness to me that we're not using it because of our political beliefs. And it's people on both sides. That's not the case. We're not using it because it's a garbage medicine for COVID. It's really great for things like rheumatoid arthritis and for patients with lupus. But we've heard from so many of them as prescriptions increase for hydroxychloroquine for COVID prophylaxis or treatment, that it's become way more difficult for people who have been on this medication for other reasons for a long time to be able to access it. And that's the downside. That's why you shouldn't just be willy-nilly taking it in addition to all the potential impacts and side effects it have.
As a physician, you see all kinds of different issues with your patients. You don't actually have the luxury, my limited understanding based on Grey's Anatomy, which I do not suggest children. My 12-year-old has been watching it, binging it, and my 15-year-old watched it. It inspired her to want to be a doctor. My 12-year-old watched it, and negative consequences. She's like, I need a CT scan. I'm having a lot of chest pain. I'm like, you need to stop watching that show. But my limited understanding is that you don't get to see a patient and say, I'm sure you do say this, but not within a range. You say, we could try to do this. We can try to do that. This will bring these consequences and options. This one, there are a couple different treatments. Maybe there are no treatments. Maybe there's just one treatment. Your choices, though, they're actually legal consequences. You can't choose to experiment with a patient if a drug or a device hasn't been tested. I was talking to an ER doctor who is also an inventor. He invented a device that uses a patient's hair to stitch instead of stitches. It's great, but he can't use it because it hasn't been approved yet, even though he knows that little tool he made works. Explain to me your set of choices and the legal consequences if you were to just say, you know what, why don't we just try this?
Yeah, well, there's this organization we call the FDA, which has been in place for quite some time to basically prevent us experimenting on people, because that's exactly what it is. And that's happened in American history. There are a huge amount of ethical considerations around how we treat people, what we treat with. This is part of the reason we can talk about this as well. Part of the reason there's so much concern around vaccine hesitancy, anti-vaxxers. And even if we had a COVID vaccine today that was 100% perfect, we'd still have a really hard time convincing people to take it, because there has been in this country experimentation on certain people or withholding certain medications from certain groups. Tuskegee is one of the most saddening examples of that. But basically, when I go to work, I can't come in on a Monday and say, we're going to use drug A for this. And then on Wednesday say, you know what, I actually want to use drug B for this. But we have a range. Science itself works within, a certain set of boundaries. Whereas for most patients I see, very rarely is it 100% certain exactly what's happening and what exactly I need to do. Be in the 80s or in the 90s. Very rare is it that I'm like 0% stumped and need to call in Dr. House. A lot of it is that discussion that I have with patients around, hey, it looks like you've got this and maybe a little bit of this. We can treat with this. The side effects may be this. A lot of it is more just that decision and discussion between myself and patients, looking at what our different options are. But never am I going to say like, hey, you've got this thing and I've never actually used this before, but I'm going to ask you to go home and just and bathe in old honey and hope that it gets better. So doctor,
that's a turkey baster filled with honey. Yeah, it goes straight.
I've heard good things.
Yeah, but right in my ass, if you say so. I mean, you're the one talking to the former president. Get it in there.
I didn't say which end had to go first. It's up to you.
There's been a lot of obvious concern and discussion and debate around going back to school. What do you see are the obvious concerns and consequences? And can you see certain situations where, who was it that told me if it's under about 5% or something, then it's probably safe in your area. But gosh, we're all scared because if someone's asymptomatic, then you wouldn't know. They're not sick. They don't know they're sick. They're going to school. How do you see the going back to school? Is this an easy call for you, or is it really challenging given the fact that there's 13,000 districts?
Yeah. I don't think this is an easy choice for anyone in the U.S. right now. Like, there's just so much virus circulating in our communities outside of places like New York City or New York or some places in the Northeast where the prevalence of the virus is extremely low, which we know by testing. Like 1% of tests come back positive in New York, whereas in places like Texas or Alabama, Mississippi, Florida, it's much higher than that, 10, 15, maybe even 20%. That just shows that there's more virus in the community. If you send kids back to school in communities where there's a bunch of virus, it will circulate amongst those kids. It will circulate amongst those families. Like, this is not rocket science. This is just the way that this virus works. And we know that. I think I look at it in two different ways. Places where there's not a lot of virus, like New York, and places where there is a lot of virus. It's a lot easier to talk about where there is a lot of virus. It is pure folly to think that it's safe to send kids back to school in places where there's a bunch of virus. 5% is one number. Maybe it may have to be a lower threshold, 3% or 2%. It's hard to say. We're going to learn a lot. Places like New York that are opening up. But I think what you're seeing is that the science is pointing to people recognizing, and families and teachers recognizing, it's just not safe, and we don't know enough right now. I think 13 of the 18 large school districts are now going online only until we know a little bit more information. In places like New York, it's not just how much virus is there. It's also, are you going to have social distancing in the classroom? Are you going to think about how you protect the most vulnerable students and teachers? Are you going to mandate mask wearing? Are you going to think about the kind of how kids move through the school? Are they going to primarily stay in one classroom and have teachers move? There's a lot of other things that need to go into this. And maybe the most important is, what happens when inevitably there is a case? Because everywhere there's going to be one. What is the process for finding that, for isolating that, for doing quarantine for everyone that has been in contact? If that's not done well, then it's going to fall apart everywhere. Whether you have 1% or 10% of tests in your community positive, it's just more likely where there's more virus. Does that make sense? It
all makes sense. And I think the most important thing is it's not simple. It depends on where you're at. And it depends on where.
It could be simple. Let's be clear. We're now half a year into this pandemic here in the U.S. The reason that it's not simple and that we're not doing it the same way that many other places have been doing. I was like, people in Germany are going back to school, and in Denmark, they're going back to school. And my friends got their kids in the Netherlands in the school. Yeah, because they don't have virus just like everywhere coating their community. If we were serious about this, not even 6 months ago, 5 months ago, 4 months ago, but 3, 2, a month ago, we would be in a much better position than we are right now. You hear in Mississippi, it was just in the past couple of days, they opened back up schools. 100 people are forced into quarantine when a couple of people tested positive. This is going to take place in every single school that doesn't take the right measures. Now, I think it's also important to recognize and to state out front, I'm not the person that's saying, well, if we're going to have a case, we need to close down all schools for the rest of eternity, and you will learn from an Apple iPhone or whatever. We recognize that there are trade-offs, and I have a kid. I've got a nearly 2-year-old that I would love to send back into daycare. I would absolutely love that. I just don't feel right now. And we all want to do this. School is so important for kids. It's also really important for families that need to go to work. There are mental benefits, there are emotional benefits, there are academic benefits. The goal should always be to kick kids back in school. But as of right now, in a lot of places, we can't do that because we failed 1, 2, 3, 4, 5, 6 months ago.
But a lot of the research and anecdotally, kids aren't getting sick and dying overwhelmingly. There have been individual cases. So why is it that much of a concern?
So it's interesting that you asked me that. I was just reading before we got on this call, the CDC today put out another MMWR, which is these weekly reviews that was looking at exactly this issue about transmission amongst kids and the impact of hospitalization amongst kids. They found that, the likelihood of kids being hospitalized for COVID is significantly less than it is for adults. Great, we know that. But if they are hospitalized, the likelihood that they will have to go into an ICU is 1 in 3, which is pretty similar to what it is for adults. So we know that there are severe cases. In the past couple of weeks, there's been a lot of studies showing that kids not only get sick, but they actually transmit the virus pretty damn well. And we've had kids inside, right? The kids have largely been inside. There's other studies showing that once we closed down schools, primarily in March, that decreased the amount of viral spread in communities. The inverse of that is that once we get kids back into school, there will be a spread. And even if it doesn't, impact, we don't have a bunch of kids dying across the country, kids that get infected at school who will be infected will go home, will infect their family members, will infect their teachers. And this is going to be the problem in terms of how we control the amount of virus in our communities. If we're not testing enough, if we're not doing the bread and butter public health principles of like contact tracing, then it's just going to fail. So even if we don't have, this mass death of kids, which again isn't, there's going to be infections. There's going to be kids that die from this virus. It's already happened. The question is like, what are we willing basically to kind of accept to, this balance of getting kids back into school, which is super important for their health as well, versus shutting everything down and, making sure kids don't get infected. There's some middle ground. We're learning a little bit more about how to make those decisions, but a lot of that is dependent on things that are different in different communities, and then personal risk or family risk, which is different in every household.
Where are we on testing? Where should we be on testing? If Dr. Craig Spencer was the Surgeon General or whoever would be the person that would be in charge of testing. If you were the testing czar, where are we and where should we be?
Oof, man, you're just downer today. So this is actually this week was the first time ever since the beginning of this outbreak, since we started doing testing, that we had a decrease in the amount of tests that we were doing. So a pretty substantial decrease in the amount of tests that we were doing, by the order of like a couple 100,000 cases compared to last week. So we're not doing great. We weren't doing great with testing last week. We probably needed about 3 times as much testing as we were doing. It's not just the magnitude. It's not just the pure numbers of how much. It's how quickly do those tests come back? And we've been hearing here, even in New York, like you can get a free test. Everyone can get a free test. It's taking up to a week or more.
Right.
I did a very informal Twitter survey. And I think a couple thousand people responded, and almost 50% of tests were taking more than 4 days to come back. At that point, it's not really helpful, right? Like you get a test, you go home, you're like, all right, I'm just going to wait around until I find out. And it's a week later, you're like, well, even if I was negative then, who knows what I am now? So what we need many, many months ago to scale up vastly our testing. Part of the problem that we're having right now is because we're not doing enough. We need 2 to 3-fold at least to testing of what we're doing now to be able to kind of safely get back to normal in our society. And we're just not doing it. There are other options. There are these like really kind of quick 15-minute antigen-based tests, which aren't as accurate, but they're a lot faster. At least the earlier versions of them, there's a lot more that are in testing. They work in a different way. And so they're more likely to say, for someone that is actually positive, they're more likely to say that you're not positive than a regular nose swab PCR test. Some of them have got pretty good numbers and are, have a high sensitivity. We need to have them at a pretty good accuracy to be able to use them wide scale. But I do think if we had millions and millions and millions of those, that could drastically change how we function. You could go out to things. If you had a 15-minute test, that would allow you to, I think, have different gatherings, have more safety in knowing that people that are in a certain place, like schools, for example, are infected.
Do you hear about a video of an anti-masker being called out in public? If you hear that, do you watch the video or do you skip the video? Because those videos are my new porn. It's outraging.
You need to go back to old porn.
Yeah, well, it's I don't know. Old porn, like really old porn, maybe.
Yeah.
And there's got to be a mask involved. But like the idea that people are that we're divided over this, if we can put that, I'm fascinated by human behavior and obviously frustrated as hell about it as well. Almost everywhere I go, I live in Rockland County, New York, the suburbs of northern New York City, people are wearing masks. But That is not true of all over the country. As a matter of fact, I think this weekend they're having the Sturgis motorcycle gathering in South Dakota, and they're expecting like 250,000 bikers to show up. At least they'll be outdoors. But I don't know. What do you? I'm trying to find something else to talk about that doesn't necessarily. I want to hear what Craig Spencer. If you watch those videos and if you get any, if you're just more frustrated by them, or if you're satisfied watching people get yelled at like I am, or even beaten up.
Yeah, no, that's when I'm doom scrolling, that doesn't necessarily come across as the thing that I'm most likely to look at.
Doom scrolling,
yeah. I mean, we know, we do these kind of like postmortems of why it's so bad in this country and why it's hard. So much of this anti-masking relies on the deliberate undermining of science and public health from the beginning, largely by this administration. This is the end result. Everyone was so pumped when the president put on a mask a couple weeks ago.
Yeah.
Yay. Like the CDC has been saying to do that since April. I mean, a lot of this is because as public health experts, we didn't know really early on, and we didn't do a good job of communicating whether or not people should be wearing masks. We know now unequivocally that they help. Are they 100% effective? Nope. That's why it's important to use a mask with washing your hands and keeping your distance. It's so hard to turn around that messaging that a lot of people got in their head early on. And for other reasons, it's stuck there. A lot of it partisanship as opposed to public health. But, there are reasons to be encouraged and optimistic. The mask use has actually increased pretty substantially, both among Democrats and Republicans in the past couple months. There is still a huge divide in between those groups. So the likelihood that someone is wearing a mask as a Democrat or Republican is still vastly different.
That's a weird thing, yeah.
Because this virus doesn't care. And yeah, I mean, we just have to keep pushing this, but like, it's hard. I mean, I stopped getting angry at people. I stopped getting like vicious and super upset because at this point, I think people know, unless they're just watching Laura Ingraham all the time, people know that like a mask is helpful and it's not just about you. It's about you not infecting other people. And, you could say we have this long run of individualism in this country, and that's why we decided to do this. No, we just don't listen to science. And people are like, oh, you changed your mind. That Fauci, he changed his mind. Yeah, that's good. That's what science does. If we didn't, like, all of us would still be getting, our veins opened up to bloodlet anytime that we were depressed. Like, yeah. Science needs to change. If you are listening to people who haven't changed their opinions, Peter Navarro, in the past couple months, and like, you're listening to the wrong people.
Speaking of that, where are you on leeches?
Listen, they have a role. They have a role. I had one when I was 9. It kind of scared me off from leeches for a while. But they do have a role. They could be helpful for some things. Actually, I'm not sure. No, they're not helpful.
I don't know. I just remember Stand By Me.
Better than a baster of honey, but...
Honey baster. Hashtag honey baster. All right, let me ask you. You're also tweeting about the very sad fact or outcome that a lot of public health officials and scientists and experts and doctors are having their lives and their families' lives threatened and being doxxed. You were tweeting about that. Has it happened to you? And what do you say to those that it has happened to? What about that crazy, crazy consequence that people are threatening doctors and experts?
Yeah, I mean, it hasn't happened in a few days, but basically for months, like a day didn't go by where I wasn't called a murderer. Or someone told me that like I should rot in hell for not giving hydroxychloroquine to all of my close loved ones or whatever it may be. Like, and it got to the point where it's just I was like, okay, this again. But I lived through Ebola. I had a bunch of other people told me horrible things or said horrible things about me then. So like I've got a thick skin. But there are a lot of other public health professionals all over this country that have left their positions, that have straight up retired or left because they were getting death threats, because people were showing up on their lawn, they were getting doxxed, their information was being leaked. And they're just like, well, I'm not, this isn't worth it, to have my family under threat. It's absolutely crazy. And it is pretty widespread. I mean, if you just look to the response to that tweet that I sent a couple of days ago around that, I think I said something like, hey, other countries, your public health experts get death threats in the middle of pandemics.
Yeah, what was it? Yeah, that was a great question. What did people say?
Most of it was like, people in Canada are like, no, up here in Vancouver, like the, shoe designers have made a shoe in the honor of our local public health experts. I mean, there are some in some places, but, look at the other public health experts that either kind of retweeted that with a comment or commented on it and basically like, this is what public health advocacy is like in 2020. Like, this is our norm. It's not just me. It's not just Fauci. It's basically anyone that stands up and makes public health proclamations based on science that run counter to the partisan messaging largely of this administration.
Yeah, it's so disappointing, so bizarre. The only criticism, I mean, how did you feel when you saw Dr. Fauci throw that pitch? How did you feel when you saw that? Were you disappointed? Were you surprised? Did it matter a great deal? I was disappointed, I gotta say.
No, absolutely.
I mean, he's almost 80. I get it, but
I was actually quite heartened because look at this guy's commitment. Like, he is just committed to no one ever catching anything. Like, this guy is on it. That's just, like, he's not going to throw you a softball. Like,
I wish he had that line. That would have been perfect. That's awesome. All right, man. Well, I appreciate your time. How are you doing? Last question. How are you coping? Your Twitter feed is great. It's very humanizing of you and what you're dealing with. And you had a great tweet about, for those of you that think I'm always doing this in medicine, I spent like an hour dancing in front of my 2-year-old, singing Elmo and stuff. And you and I talked the first time we spoke a little bit about parenting. How's it going?
Yeah, going great. It's going really good. She's at this point. Yeah, we had that chat and you're basically saying like how you've structured your career to have more time with your family. And it's super important, especially right now when I'm working clinically and writing and going back into teaching and thinking about how to take time at this time in my kid's life where she is so young and impressionable, and like I'll say something and she'll immediately repeat it. And then every day I'm just kind of blown away by something that she's doing. And I know all other parents go through this process and it's cool and it's great, but like it's a tough time for so many of us. It's a really tough time for me and my wife who works a full-time job. And, we're trying to enjoy the summer as much as we can and spend it with the kid. It's a challenge like it is for everyone, but we're having a blast. That being said, she's sleeping right now. And we had a bit of a negotiation right before we got on the call. I thought I might have been a little late because only one of her babies was in her bed and she needed both of her babies. So I got the other baby from across the room, put her in her bed, and then the baby needed to get dressed. It's a whole process. She's going to take the clothes off. I knew it was coming next. So we had this talk down and eventually I got her down and she went to sleep. So she stayed down and I'm hoping she stays down for a bit. I got to go to work in about 6 hours. So I'm hoping to get a little nap myself, which is doing it.
Good for you, buddy. I'm glad to hear that that's going well. And you're not, I always counsel parents to strike the phrase, I can't wait, but I'm going to break my own rule. Have you thought about the conversation that you're going to have at some point with your daughter where she says, Daddy, tell me about the conversations you've had with Barack Obama?
No, I did this video a couple months ago with Al Jazeera, basically where they took some of the stuff that I wrote and they had this incredible animator.
Yeah, it's so great. I shared it. Yeah, and I'll share it again. Yeah. It's so good.
But what the big part of that was like, I remember talking to my wife and being like, is this something that we want to do? And, not knowing the impact that it would have and how important it would be for people to understand what was happening. But part of that video, they used I think I mentioned this last time, they used my wife or my kid's voice, like her laugh and one of her, her saying dada in it. And so part of it's like, this is really cool. Even if no one sees this, like in 18 years, I'm going to embarrass her when she brings a boy or a girl or whoever home. And I'm just like, look at how cute Juno was when she was just a couple months old. So, I think that's great. By then, Obama, people don't even know who these people are. They're like, who are these people?
They'll know.
Jimmy Carter, who was that?
They'll know. Yeah, your daughter will definitely know.
William Taft.
Daddy, tell me about your conversations with Dick Gephardt. Craig Spencer.
Yeah.
You're the best, man. Your personality, your sense of humor, your dedication, your passion, your understanding. It creates an awesome confluence of characteristics that make you not only an awesome physician, but a great communicator, which is sometimes hard to come by. Thank you so much for talking to me today, and I wish you the best. Go get a nap, buddy.
I'm gonna. You didn't mention the dimples you can swim in or my chiseled abs, but
I didn't. I would like to see you with your shirt off. I did Google Craig Spencer topless, so if anybody wants to look at my internet history,
honey baster.
All I saw was you with a honey baster full of honey. I do. Your hair is wonderful. You have a thick head of hair. Do you have any concerns about ever losing it?
No, I don't. I didn't mention this last time, but growing up, I'm glad that I have a good head of hair now because growing up, in fifth grade, the handsomest boy was Eric Smith, and he parted his hair down the middle. And no one ever explained to me what to do with my hair until I was in college. And that if you part it down the middle, you look like an absolutely crazy person about an hour later. Yeah. So growing up, I cut it really short. My best friend went bald when he was 19. And then it was just like 2 years ago that I realized, like, well, this isn't the worst stuff ever. So I got a full head. I'm just going to own it. I'm just going to let it go. I'm going to let the curls over.
And do you know where the Smith boy is now?
I don't. Probably being extremely handsome with great hair. I mean, it was remarkable. It was remarkable.
It's remarkable that the parted in the middle was a thing, and that it hasn't actually made a real comeback, at least for men and boys, I think.
Give it time. I mean, this was cool in like the late 80s, early 90s. Like, I think it's only a matter of time, right? Well,
I'd like to see a randomized controlled study on it, but
maybe the next time you have me on, I'll surprise you.
Dr. Craig Spencer, follow him. All the stuff is in the show links. I'll back sell it once I put it in the podcast. Thank you so much, buddy. Appreciate it.
Thanks for having me again. Let's do it again.
Awesome, dude. Awesome. Thank you so much. All right. Dr. Craig Spencer. Wasn't that good? Isn't he great? Love talking to that guy. So psyched to get him on the podcast. I'll try to talk to him every few weeks or so. He's a really great guest, and I loved that conversation. I hope you took something from it. He's on Twitter, by the way, if you want to follow him like the president does, former president, at Craig_A_Spencer. Go listen to, read, and watch his story. A very inspiring guy with such an upbeat, amazing personality who I'm happy to count as a good guest and I think friend here now of the show. Okay, now joining me is my next guest is a former lawyer, practiced corporate law for nearly 20 years. She is the creator of the viral hashtag turned movement, hashtag Oscars So White. She has been challenging the lack of representation of marginalized communities in entertainment since 2015. And she's involved with all kinds of really interesting, important organizations and movements, including new ones that she announces here in our conversation. She is on Twitter at Reign of April, and we talked for about an hour. I think you're going to really enjoy this conversation. I hope you do. It's an important one, and I really love and respect this woman. Here's my conversation, my most recent one, with April Reign. How do you handle the question, how are you? How have you been when you haven't talked to somebody that you know, even a little like me, for a while? Because I feel like I have to give. I've always felt like I have to give like an honest, not small talky answer to a question. Yeah. But now more than ever, I'm careful about how I answer it.
It's interesting, and we may have talked about this before. I feel a little bit of guilt, actually, in having the how are you conversation, because I do want to be authentic, and I hate people. So not having to be, no, don't make that face. Not having to be around people is not affecting me as much as it is many people. Right?
Yes, yes.
I also recognize that I am very privileged in that, the mortgage is still paid every month. I'm not having to be as concerned as so many people are with respect to, whether there's going to be another stimulus. My kids, my immediate family is healthy. So it's hard to say, I'm doing okay when there are so many people struggling. So that's my difficulty in answering the question.
And I hear a lot of folks with similar guilt that they are carrying said another way. A friend of mine is really doing well in his job at his company, and he feels guilty. He feels guilty that he has a job and that he's doing well. And it's a really interesting kind of byproduct that a lot of folks are carrying around guilt because they're not as in bad shape. Yeah. Or suffering in a way. But let me ask you, when you say you hate people, you like the people you like, right?
Yes, but it is such a small number. and I'm part of it is me being a Taurus. I think that we keep our circle very small intentionally because we are big with respect to loyalty. And so you have to work your way into our inner circle. Once you're in there, we will ride or die until the wheels come off. But it takes a lot. So,
well, let's putting astrology aside. What do you think the psychology is around that? Because I think that's a pretty normal archetype that loyalty is hard to come by, that my life's experience has, explains why that is. And so I count my friends few, and I don't, maybe I don't want to put words or thoughts in your mouth, but I don't trust that many people.
Yeah, I mean, I think all of that is true. You're making me get introspective, and we're like 4 minutes into the podcast, which is completely unfair. But part of it may be that my dad was in the military, and so we moved around a lot.
Yes.
So I was constantly making new friends, but wasn't sure how long I'd be able to keep them because I typically didn't, back then, we're talking the 70s and the 80s, there was no internet. And so me writing letters, using the phone for a long distance phone call for my friends probably wasn't high on the list of things that my parents allowed me to do to keep in touch. And so I was always making new friends. And so there was almost like an expiration date. You're going to have these friends for 18 months and then we're going to move again. So maybe it doesn't make sense to have those really. So it wasn't until college. I went to the University of Texas for both undergrad and law school straight through for those 7 years. And one of the reasons I picked that school was because it had a great business program undergrad and it had a great law school. And I knew that I could be in one place for 7 years. And so if you look for me for long-term friends, they start in college. And even then there's just a few.
You should write a book called 7 Years in Austin.
It would be an interesting book. I enjoyed my time for the most part until the racism started.
I'm sorry for laughing. I wasn't expecting that. It was great until the hail began to fall on my glass car.
Until I had to have, big hulking football players escort me to and from my apartment because I was getting death threats. Other than that.
When and why did the racism begin? Was there an event?
Yes, there was an event. One of the white fraternities. Now, this was spring of 1990. Okay, I was a junior in college. One of the white fraternities was having like a 3-on-3 charity basketball tournament, as they often did. And again, 1990, this was the height of the Michael Jordan era. So to publicize their event, they had T-shirts made with the body of Michael Jordan and the face of Sambo. That's what started things. So I was the vice president of the Black Student Alliance on campus. UT at that time had about 50,000 students. 3% of them were Black. And so that's about 1,800 Black students, and we all knew each other. And so we mobilized and organized as 18, 19, 20-year-old kids to protest what was clearly racist. And that was not the first time that particular fraternity had issues on campus. And so there was a lot going on. But, as we see even today, what is that, 30 years later, that protest comes at a cost. And so there was some backlash against some of the more visible people who were leading the protest.
Protest does come at a cost. I don't think people think about that much. The people who protest understand it intimately, but the people who are judging, ridiculing, or supporting from a distance don't generally understand the cost. And I guess the cost can be, obviously, it could be to your life, your body, but it really probably more commonly could be to your reputation, good or bad.
It can be. It can be to your emotional psyche. We don't see it anymore because the media has decided it's no longer newsworthy. But people are still protesting in Portland. And it's been, I think, over 85 days consecutively. And there are still protests happening across the country. After Michael Brown died, there were protests for weeks and weeks and weeks in Ferguson, Missouri. So it can be an emotional toil. And cost on people. You're protesting, but are you seeing change? Is what you're doing worth it? Should you go out yet another day? I saw Senator Harris questioning someone the other day in Congress and asking, are you taking precautions with the, chemical irritants, which we all know is really tear gas that they're using because there are pregnant women in the crowd, and how might that affect them? And of course, there are also employment issues. If you're protesting every single day, what is going on with your job? And even if you're able to work a 9 to 5 and then protest in the evening, how are you making dinner for your kids and, getting them ready for online school or whatever the case may be? So it is a lot, and it can be a full-time job.
Pregnant women should not go to protests, and people who have jobs and responsibilities to their families also should not prioritize protests.
Well, if that's the case, then who's left, right? That's part of the issue. How do you determine? Because
nothing but George Soros has paid protesters, I guess, is what's left.
Yeah, right. Yes, all three of them, right? But then how do you choose? How do you determine? Because everyone comes to a protest or comes to a point where they say, I can't take this anymore. I need to do something. And maybe it's standing in the street. Maybe it's making that poster. Maybe it's donating to a candidate who is running, against the person in office who hasn't made a structural change.
I want to change gears and say something here that I was like, I want to wait till April and I are talking. And I want to say this about you and other people specifically that are not the same color skin or gender or whatever that I am, that I talk to here on the podcast, because I wanted to get your reaction to it, which is, I always feel a little uncomfortable when I'm talking to you or a black man or, a Hispanic person or even a gay person about race and, in your case, gender, because I feel like folks listening, and even my guests in this case, you could think, well, why are we always talking about race and gender? I can talk about anything. And in your case, you're a perfect person. You can comment on any part of culture. I think you and I could have probably a fascinating, entertaining conversation about almost anything from weather to parenting to food. But I feel like when I'm recording a conversation with you, I want to have the conversation that people should want to hear and maybe have, and ask the questions that maybe people don't know to ask or are afraid to ask about the issues of race and gender. But I feel like it sometimes might sound limiting or to put you in the box. So I just wanted to say that to you on the record, get your response about how we have these conversations, and if we should broaden them, or if it's okay to talk about, a more narrow range of issues that certainly you have the credibility and life experience to speak about.
I appreciate that. And I appreciate the fact that you recognize that. And I think you're doing it the right way, and it's not just about you, God forbid, but it's more about your audience and providing a means for them to, learn more or ask questions.
Yeah, that's why I'm recording it and going through the trouble of, editing it and posting it and promoting it, for sure. Exactly. Just to be clear. Go ahead. Sorry.
But no, that's okay. But there are times when I get invited to speak, at a conference or something, or on a panel, and it's very clear that they want me because I'm a woman, or because I'm a Black woman, or because I'm a Black person, and they're just checking off a diversity box, or somebody pulled their collar and said, hey, we're having this talk about diversity, and it's nothing but white men on the panel, which happens all too often. But I think that, when you and I talk, we do run the gamut of all things. We started this talking about parenting and just life in general. That's not specific to any particular race or gender. And the answers that you get from me are through my lens as a Black, able-bodied, cis, hetero woman. And when you talk to other people, you will get that lens. But I don't feel like, I think you're doing a good job of asking questions that could be asked of anyone. You're just going to get, hopefully, more insightful answers because you intentionally bring on diverse guests. So kudos to you.
Well, I wasn't fishing for a compliment. I appreciate it, though. But I was more just wanting to get your kind of framing and response to that. And yeah, I mean, we can, you and I, talk about anything. And there can be cultural differences. There can be generational differences, although you and I aren't that, I don't think, different in age. And so we have a lot of the same kind of, generational references probably. But culturally, there can always be a lot of differences. But there's also a ton of overlap in the things that we're interested in and the things that we do and that we watch and so on. but I feel like we just don't talk about those things as much. But that's also because we self-segregate so much. And I think I told this to Jason Johnson, our mutual friend, last week, which is we already had a major problem with the way that we self-segregate. And we can talk about why we do that. But in America, and it's so much worse now because at least you used to see people who are different from you at your job when you would go to your job and be forced to maybe work with them, be in a car with them, be in a conference or meeting with them. Now you generally live around people that you're like, generally. And so you're mixing only with people that are in your kind of category. So it feels like the pandemic and the quarantine and the lockdown has created a lot less opportunity for us to mix. What do you think about that idea?
That's probably true because the choices that we make now with respect to, who we are around are very intentional, because if I'm going to risk my life, it needs to be for somebody I love. And to be very clear, I haven't risked my life for anybody because, so other than going to the grocery store or something once every 2 weeks, that's the only interaction I'm getting with folks from outside of my home. But I want to flip the script a little bit and say that while not being able to go to work and interact with folks means that there's been less mixing for people from marginalized communities, it has been incredibly refreshing for a lot of us. I am working on, and this is, I guess, the big scoop of today's podcast, I am working on a campaign called She Will Rise to nominate the first Black woman Supreme Court Justice. And I am working with a team of Black women, period. There are 4 of us on the initial team, and then we hired some outside consultants who are also Black women who own their own companies. And it has been, and I literally said this yesterday on our team call, how refreshing it was that there didn't need to be any code switching, that we all could, say what we really felt, that we could all hold each other accountable and be very transparent in love because there's this ongoing meme that says, Black folks always hold a meeting right after the meeting to talk about how bad the meeting was, right?
Yeah, I was offended by that this week. I was finally offended when I saw that this week. I was like, I'm sure that they do that. I get it. But I think we all do that. I don't know. It's different. Yeah, because you know who's on your team at work, and you just start the people that you trust. I think it's an implication of like a trustworthiness based on gender or ethnicity, where you realize that you're marginalized even at this job, or that people just didn't include you or understand references. But I saw that trending this week. I was like, and I did see a lot of white people boldly being like, we do that also.
And maybe you do, and good for you. But, but I think it's different when we do it. It's probably more intense.
Yes. Yeah.
Probably more intense when we do it. And so not having to do that at work, I'm sure it increases productivity when you can just put your work down, put your head down and do the work without somebody, popping their head into your office to tell you that they just sent you an email. Well, I just got the email, Bob. So I don't need, so that part of it, I think it is helpful for everyone, even if it means that we literally cannot stand around a water cooler right now.
Well, let's then talk. I mean, have you announced publicly She Will Rise? What's the campaign behind it? Because that's a pretty interesting campaign to get the first Black woman ever nominated to the Supreme Court. Where did this idea come from? Has it been announced? How do we learn more about it?
We are rolling things out slowly across all social media platforms, Facebook, Instagram, Twitter, and TikTok. Our handle is Sista SCOTUS, SISTA SCOTUS for Supreme Court of the United States. And so we've just started posting across all of those accounts. And so you will see us talking about historical Black female lawyers and judges, and also some of our favorite fictional ones like Olivia Pope and Maxine Shaw and Claire Huxtable, who were attorneys on TV. And so the rollout will continue. We're going to have merchandise. We're going to have several events around the debates, the presidential debates. We're going to have a huge panel discussion coming up in the next couple of weeks with some people that you may recognize. And it's going to be ongoing. Vice President Joe Biden committed to nominating a Black woman to the Supreme Court when he gets the opportunity.
Oh, he did?
Yes, he did. That's what started this. He committed, yes. So this is obviously different from Vice President. Yes, he did commit. And so what we want to say is we think that's a great idea. Let's mobilize grassroots support for you, and just show you all of the amazingly talented Black women who are out there now as attorneys or judges who might make a great fit for the Supreme Court.
I love it. It's very interesting. Why does it matter the vessel that you're in when it comes to a Supreme Court justice? A lot of people will remember Sonia Sotomayor talking about a wise Latina. Well, yes. I forget the quote, but I remember hearing that and being like, yeah, of course, that makes a lot of sense. And then, of course, the outrage began. I was like, wait, what? Why doesn't that make sense? But in your words, why does it matter?
It matters because, especially now, we know that the Supreme Court is going to be grappling with issues that affect marginalized communities, like women's health care, like immigration rights, like voting rights, like education, right? And you can have two sides of the spectrum, to be very clear. On the Supreme Court, we had Thurgood Marshall. We now have Clarence Thomas. They, same color of vessel, right? But vastly different political and judicial views. What we're saying is that, just as you and I, look at things similarly, look at some issues similarly, we bring our own lens and our own experience to those discussions. And so we would love to see a Black woman on the Supreme Court for the first time ever be able to impart her experience and discuss how she sees things through her lens in making these very important decisions that are going to affect millions of Americans.
Well, let's then, I'll put all the links to that, by the way. She will rise at Sister SCOTUS. That wasn't taken. You didn't have to go with like Sister SCOTUS 974.
No, sir. I jumped right on that.
Well done. I'll put all that in the show notes for this episode. But the same kind of conversation and question around Joe Biden's vice presidential pick, which we're going to know any day now. One of the interesting things
he says, I said yesterday on Twitter, he is, and his team, I know it's not just him, they have really turned this into LeBron's The Decision, to take his talents to South Beach. And I'm supportive, and I'm waiting, and I'm ready to go. But it's like, geez, Luis, you knew you were running for a long time. You knew, I'm sure you've had it narrowed down to, let's say, 5 for over a month. So, take the women out to lunch, do whatever you need to do, go through their background, because part of what I'm seeing is twofold. One, the women so there are several Black women in contention. Right. And I have a considerable concern with the way that those Black women are being vetted in the press. It seems a little more than let's just find out what she's done in her past, but let's tear down every single person, every single potential VP pick, so that regardless of who it is, we're going to know all of their dirty business, assuming that there is any. And it's like, oh, you could have done so much better. And so I think Joe Biden already has an enthusiasm problem. If the media takes it a step further and says, oh, well, we can't even get behind his VP pick. No, I'm not voting for Joe, but I'm really excited about his vice president because perhaps she will become the president next. If we tear whomever that woman is also, down to brass tacks, then how do we get an already depressed electorate out in November?
Yeah, I think that's inevitable, and it probably happens every time around. And I also get concerned that, it's happening between the actual candidates that are in the running, kind of dropping and leaking stuff on the other people, which is, even more disconcerting. But it's also typical, of these situations. And I feel like it's inevitable. But what you just said about the damage that gets done to that person's reputation and future is also true. Both things are true at once. But how this week, or was it last week, we heard that, Kamala Harris was a little bit too ambitious. I think it was Senator Chris Dodd who may have said something like that, or that leaked. I don't know if he said it publicly. By the way, the president, I get it that Joe Biden has old white guys that he trusts. I get it. That's fine. But I think that he should not have them have so much influence on his choices and campaign, especially Chris Dodd, who I find troubling. But nonetheless, how do you react? How did you react when you heard the criticism of Kamala Harris being ambitious, too ambitious?
Yeah, what does that mean? I mean,
she wants it too bad. She wants this job too much.
I don't know that that's necessarily true, because we haven't seen in the way that she wanted to be president. So, but I don't know that she wanted to be vice president, right? She wasn't running for second place.
Well, it's a good spot to be president. It's the best spot, but yeah.
Yes. But I mean, isn't that what we teach our children? You can grow up to be president one day, right? I mean, we attempt to instill that's the highest office in the land. It's incredibly responsible. You get to take care of hundreds of millions of people. So if someone is ambitious for that job, isn't that what we want, as opposed to someone who, oh, well, I guess so, I'll help you out because your campaign is faltering. So yeah, I'll do it. But maybe only one term and you'll have to get a second VP for the second term or something. That's silly. And why is it that it's only Black women who are too ambitious? Was the same said of Geraldine Ferraro? Maybe. I don't know. Was the same said? I've never heard
I think it's probably said of women a lot because it's new. Sure. It's a judgment that probably more often comes from men, in that we see, because
we're not staying in our place.
Yeah,
That's the bottom line.
Or even if it's less, even if it's more innocent than that, I think that there's a lot of truth to that, obviously. But even if it's like it's kind of maybe a little uncomfortable to see a woman ambitious. You don't know why, but it is because of the root, I think, of what you said. You're not staying in your place, but it's like, tone it down a little bit. You seem sometimes things that people do of a different gender are surprising to you because you're just not as used to them. Is anybody surprised ever when a man does anything he can to get to any goal that he wants? I mean, generally not. He's very, very aggressive. If he stabs people in the back, I mean, people aren't surprised by that. Why would it be surprising if a woman does something, especially in a career-focused way? Because we're not used to it. And yeah, stay in your place. This is a man's game or something like that. I'm sure that plays out heavily in a lot of men's mind, and probably some women too.
And not just politics, but in every single industry. I mean, we saw it when Hillary was running in 2016.
Oh, yeah.
As you mentioned, there were a lot of women who,
when she was first lady, we saw it against.
But there were a lot of women who didn't think that any woman should be the president of the United States. And it's like, how do you do that math? Where you think that, when probably in your own relationships, how things actually go down behind closed doors, who actually gets things done. Yes, you can put on the brave front and the man is the head of the household and all the rest of that stuff. But truly, who is running the house that the man is the head of, right? And so why wouldn't you want someone who is multidimensional and able to multitask, and able to provide empathy when necessary? All of those things I think are should be lauded, as opposed to critiqued. We mentioned vice presidents a little while ago. I don't know that the critique that we're seeing now with the potential, who we think are potential nominees. I don't know that we saw that, for example, with Joe Biden in 2007. Right. I don't know that we saw it, especially not before he was named. Like, I remember him being a surprise, like, Joe, really? And same thing with Sarah Palin. I mean, she came out of the woodwork. Now, once you get nominated, sure. But, but I'm talking about the way that the media is really going after these women even before, which may affect their current career. So you go after Karen Bass, for example, right? And you expose all this crap from 30 years ago, what have you, and then she ends up not being the pick. Maybe she was never even being vetted or whatever. Right. But then what does she do with her career now that you guys have, unearth all this stuff from decades ago. That's the kind of stuff I'm talking about.
I think there's a lot of truth to that, but that's also certainly a consequence of being a person, in politics or in public too. Everything you say or do is going to be picked apart, which is why it's good, why reputation as a form of currency is something I think is an interesting issue to talk about. Okay, so all this being said, do you have a preference? Is there someone? How about this for the question, April? Is there a candidate who would energize and excite you more than another candidate? Doesn't mean that another one wouldn't be great, you wouldn't be excited, but is there anybody that you really seemingly connect with and feel a sense of enthusiasm for that would be on the ticket with Joe Biden?
I am choosing my words very carefully.
There could be a couple too. You could be like, "Oh, I'd like this."
No, I get it. I'm gonna. There are a few women who I would like to see in the role. Of the women that we believe are in, the top 5 or 6, which is, Val Demings and Keisha Lance Bottoms, mayor of Atlanta, Senator Kamala Harris, Elizabeth Warren is still in there, Whitmer from Michigan, or is that Wisconsin?
No, that's right.
Karen Bass, maybe Stacey Abrams. I think they are all.
Did you say Warren?
Yes.
Yep,
yes, I did. I think they are all, and you remember that you and I have talked about Elizabeth Warren before, and I like her a lot. I think they're all incredibly talented women who would bring something fresh and necessary to the Biden campaign. There are some women who, in that list, who I would actually like to see in other places within his administration or cabinet too, right? So it's because traditionally, we haven't seen the vice president be as active, and vocal, which is understandably so. You're number 2, not number 1. And so might that person be better served, on the Supreme Court or as Attorney General or, in the Senate or, running for a higher seat in the House or something like that, because we know that Joe Biden as president is going to have a lot to undo. And so maybe he could use some support in other branches of the government to get some of the stuff done.
Whoever is standing next to Joe Biden is going to overshadow Joe Biden. Whoever is standing next to Joe Biden, I'm going to look at and be like, that person could do a better job. Generally speaking,
maybe she will 4 years from now. Who knows? Maybe he will commit to just doing 1 term. But even if he does 2, that gives her a great opportunity to learn and grow and and shore up whatever she needs to, so that we can have maybe 16 years of a Democratic president.
What was this comment? I'm trying to look up the quote that Joe Biden said about the diversity in the Latino community versus diversity in the African American community. I can't find the exact quote. The
way it sounded to me, and he's come out and apologized.
Yeah, he's trying to.
Yeah, it sounded to me as if he was saying that it sounded to me as if he was saying that Black people were a monolith. And he has since apologized and said that he absolutely understands that that's not true. And, everyone makes gaffes. This one was an unfortunate one, especially because I believe he made it during the National Association of Black Journalists and National Association of Hispanic Journalists Convention. But it doesn't mean that I'm not going to vote for him, right?
Well, and you saw that the monster has attacked him for this.
Seized on it, and yes, Joe
Sleepy Joe Biden is no longer worthy of the Black vote.
That's not bad. Is that your Trump impersonation?
Yeah, it's not a hard impersonation.
Okay, it's
really not. But it matter. Him saying that is just. But yeah, okay. So you said. I mean, I couldn't find the quote. I don't know why I can't find the exact quote of what Joe Biden said, but. The diversity of thought amongst Black Americans is obviously. I guess he was comparing it to Hispanic Americans, and I don't know. When I heard him say it, I didn't react as much. I knew it was a dumb thing to say, but I was like, well, I think he's probably thinking about all these different countries where Hispanic people come from that are very different in terms of their ideology, and politics, especially.
That doesn't fly either. I mean, we got over 50 countries in Africa, right?
But people don't think about Black people being from different countries. They think about them probably
Black Americans.
Yeah, Black Americans thinking. Yeah, they do in Kenya. No, but Black Americans. I guess people don't. They should. But I feel like people don't. You think of Black Americans as being from America, although we also think that they're not as American, obviously. That's the big problem.
But clearly, it's not true that, I mean, there are a bazillion reasons and examples of how we can show that Black people are not a monolith. But if we were, then Kanye's little presidential whatever he's doing wouldn't make sense either, right? Because we know that Kanye is in the race, sort of, to attempt to siphon off some disillusioned Black voters. And if Black Americans were all a monolith, that would be impossible. Now, we also know that Kanye's campaign is being run by Republican strategists. And so this is an attempted voter suppression, which we're not talking about enough because we're seeing it in various nefarious ways. Yeah. But so if you can take, and sometimes the way the numbers run, if you just get 1% of, in a particular demographic of Black voters to vote, to either not vote at all or not vote for Joe Biden, that could mean a win in that particular county or, that particular district or whatever the case may be for Trump. And that's the scary part. Kanye doesn't have to get a whole bunch of votes. But if he, and so the thought is that Black people as a whole are ignorant enough that we would vote for a rapper with absolutely no political experience or even interest. He's never even voted before, over somebody who is eminently more qualified, even though Biden can be problematic.
The vast majority of white people voted for a game show host and a guy who was involved with the mafia for years in real estate, like Donald Trump. I mean, it's like, is Kanye qualified to be president? No. Not even remotely. Is Trump? Maybe more on paper because he ran like a business or something, but at least
into the ground.
Yeah, but no, ground. Kanye's not known for Kanye. I mean, I don't like Kanye. I think I have a lot of problems with so much of what he's done, but like he did not pay people. He wasn't involved with the mafia. It's like he doesn't. His character is more about probably his mental illness and issues than it is his judgment on things. Do you have complicated views at all, or are they more on Kanye West and what he's doing?
My views are not simple. My views are not complicated. I'm not a fan. So I have always maintained that Kanye has not been right since his mother died. That he did not get the proper help he needed then to be able to grieve and be able to, handle her death and move forward. And I feel like he's been on a roller coaster since then, and he has, and I'm not a mental health professional, but he's had his ups and downs. And because he's got celebrity and a platform, very often those ups and downs happen publicly. And it's easier for me because, I'm going to say this is another way that Black people are not a monolith. I've never been a huge fan of his music. So being able to walk away from Kanye has been easier for me than people who are, big fans and loved Graduation and some of his other albums.
Obviously, a lot of people know about, in regards to you and your career, the hashtag Oscars So White, and you're weighing in an influence on the entertainment industry to become more diverse and inclusive. But I've never asked you about music. What is April Reign's musical taste? Is it eclectic? Is it diverse? Is it okay, eclectic and diverse? Because mine is not. Actually, I listen to a lot of different kind of music, but I don't know anything about music.
Okay.
I can't talk about it. Who do you like?
I don't know that I can talk about it either. Probably the genre I listen to most is old school hip hop from the 80s and the 90s. And typically native tongues of that era and conscious rap. So De La Soul and A Tribe Called Quest and Brand Nubians. And more than, gangster rap or more than, the Miami sort of hood rap that, Uncle Luke was putting out at that time. But it is eclectic. I'm a big fan of R&B. There's some classical that I get into. I'm a big fan of music that I don't understand, like music from Latinx artists like Mark Anthony and a few others. And I speak absolutely no Spanish, but it's just so hauntingly beautiful that I get into it. Quincy Jones has a protege as well that I really love. So yeah, it goes all over the place.
I don't think you named one genre dominated by white people or one white artist. So who are the white artists that you, what rock and roll band do you?
Bon Jovi.
Oh, that's an age thing for sure. That's, my wife would say the exact same thing.
Yeah, and where I grew up, again, being a military kid and being in predominantly white spaces, the 80s hair bands, Bon Jovi, and, there's Rat is on a commercial for something, insurance or something, and I get all kinds of nostalgic
The band Rat?
Yes.
Yes, I definitely had their albums. Round and Round, that one.
That's the only song I know, but I know it well because, again, where I was at that time.
That's funny.
Everybody gets to choose what they like. And so I always choose to amplify, support, marginalized communities. Right. So I could, I think Bruce Springsteen's Philadelphia is one of the most beautiful, haunting songs I've ever heard.
I love that song.
Way back when.
I used to play that all the time, but it is very sad and depressing, obviously. Yeah.
Yeah, but
why don't you amplify Bruce more? I feel like not enough people know about Springsteen's work.
You know what? He's got his own Broadway show. He's good.
His body of work is really not.
The boss is good.
Yeah. What about, I saw this poll this week that a lot of people reacted to. Certainly Black Twitter reacted to it very, not surprisingly, that like 50%, if the election were held today, 50% of white people would vote for, I think this is what it was, 50% of white people would vote for Donald Trump. And like Black Twitter is like, not surprised. And I don't know what white Twitter is. I guess that's the rest of Twitter mostly, but American Twitter. But like, did you see that? Did you react to that? I didn't see your reaction to it.
I did, and I had the same reaction as Black Twitter. I mean, the thing is, and we're seeing this play out with the coronavirus. People like the status quo. All people, right? Change is hard. And if you can go along to get along with what you have, as long as it's not affecting you personally, then you're not going to make a difference. Even if you literally see people being held in cages, if it's not affecting your people, you're not going to change. And so I think, and we're seeing that with coronavirus, they said, you wear a mask to help protect other people. And that is when people started saying, oh, I'm not wearing a mask. I have free speech and all the rest of that. If they had said, wear a mask to protect yourself, I think we would have seen
that would be very American.
Yes. I mean, but that's the thing, I don't care about anybody other than me.
Yeah.
And so, with respect to the economy, at least, for many white Americans, probably the majority of those who were polled in that particular poll, their economic situation is about the same or, maybe even a little better than it was 4 years ago. And so why would they change, even though they see people are literally dying in the streets?
Well, the only thing I want to push back on, I don't think you meant this, but when you said people don't want change, they don't like change, status quo, I think you're referring to specifically people that are comfortable and that vote, generally speaking, the same way to uphold their situation. But what I'm actually thinking about is a tweet. I'm going through your Twitter time. I'm actually going to do a lightning round with you responding to the things that you've actually shared on Twitter in a second. But one of the tweets that you shared really kind of struck me. I've never heard it put this way. And of course, I'm not prepared. But it was someone saying that poverty scarred them. And when they think about it, it's still so hard to overcome the poverty that they dealt with. And I'm going to find it.
And there were some really interesting responses to that.
Yeah?
people saying like, even now, I add a little water to my orange juice, or to my lotion to make it go a little bit further, even though financially I don't have to, but, it is something that has been internalized for them, for at least 20 years.
Is.
That's how they grew up.
Victoria M. Walker at...
Yeah, she's great. She works for the Points guy, and I love her to death. And the
at
Points,
Vicky.
Yeah.
Bikkie wrote, I really envy you if you ain't grown up poor. I'm almost 30. Shit still haunts me. I read that and I sat with it for a while because it's not something I can't relate to a certain extent. I have a little taste of poverty, for sure. But the idea of being there in a sustained period for a long, certainly in your childhood or through your adolescence, Dave Chappelle talks about that really eloquently and 2 stand-up specials ago. But, and a lot of people do, obviously, but I don't know. That really hit me. Rarely does a tweet or a comment really give me a lot of pause. Not rarely, but that one did today. And I interrupted you by just reading it and then fucking rambling on for another minute.
It's, we talk about aspirational generational wealth, right? But there is also generational poverty. And so people, there was a woman who, I don't think it was in relation to this, but a similar subject, who said, she walked into a store, that sold handbags and stuff, relatively high end, like maybe, a Coach store or something. And she saw this white purse that she absolutely loved. And she saw this blue wallet that was on sale. And so she said, okay, you know what, I'm going to get the wallet because it's on sale and it's more functional. And her partner said, no, go ahead and get both. And she got to the car and broke down in tears, not because he had bought her the purse and the wallet, but because she now had a white purse, which she could never get before because white purses aren't functional. Because if you get it stained, you can't use it. And because it's not all season long. This is more, for people who use purses, right? You can't use a white purse in the fall and winter. And so she had never experienced the privilege, the financial privilege of having a purse, as a luxury item, as opposed to something that was just fully functional that she could use from January to December.
That is a crazy story for me to hear with my ears, my life. Yeah. And every time you said white person, I thought you were saying white person. She never had a white person. I know. I know what you're saying.
Are we buying white folks at Coach now? And is there a coupon? Because I'm not buying y'all without a coupon. You're not worth 100% of the retail value.
How insulting that I'm standing there in the aisle on a shelf and you're like, I want that one. And I'm like, yay, I'm going to be purchased. No, not without a discount.
Not today, but maybe at 80%.
80%?
Listen, it can't just be a 5 or 10% coupon. You're not getting me out of the house in this COVID with that.
You have a lot. Okay. Now it's time for you to react to your tweets, your own tweets and tweets that you shared. There are a few tweets that you have shared about Black women saving America. Black women are the soul of America. Explain a little bit about what you mean by this Black women savior type rhetoric.
Yeah. Okay. First and foremost, retweets do not equal endorsements, although they typically do on my account. But I mean, look at the statistics. If we're talking about politics, that's absolutely true, right? Because Black women, as a voting bloc, typically, again, we are not a monolith, but typically our numbers are strongly lean Democratic every single time. It was 53% of white women, and I will never let you white women live it down, who voted for Donald Trump and swung the election in 2016. But in every other way too, we can talk about culture. Everybody's talking about the latest Meg Thee Stallion and Cardi B video, but the fact that somehow one of those Jenner Kardashian girls made a cameo. Now, why? Why were you there, sis? No one asked for that. So I think in every single industry, we can break it down with respect to how Black women, have carried this country on their backs since we were brought here in chains.
there are a lot of things being said about Black women by Black women themselves. A lot of, I think, vulnerabilities and truths coming out, and it's fascinating to finally be able to, I think, have an open conversation about it. I think America has needed this, and to some extent wanted it. Certainly, Black women have probably for forever. And I'm here. I hate this phrase. I hate watch this space, and I hate I'm here for it. But they both do work, and I am here for the conversation that is being had, led by Black women and had about Black women. I think it's the experience really very interesting and very important. So sorry for the vagaries and not being more specific, but I am here for that. It is very important. So I'm glad that you explained the soul of America and type of thing.
And to be clear, we have always been having these conversations. It's just
amongst
now.
yourselves or trying to have.
Well, we've attempted. We've always attempted
Shirley
to
Chisholm.
have the conversations in a diverse room.
Sure.
It is only now.
No one was there for it.
Right. Right.
They tried to shut it down and did shut it down.
You love that phrase. You say you don't like it, but you love it. And so I think due to the upswing in conversations around the Black Lives Matter, the movement for Black lives, right, after the death of George Floyd, I think that more space is being provided for Black people and Black women specifically to talk about these issues in a way that we always have, but to have a much broader audience. Sometimes
I feel bad for Black women who are really prominent in the public eye, including you. But I'm thinking of Michelle Obama and Oprah Winfrey and Beyonce. My daughter, who's a 15-year-old white girl, said the other day, Beyonce's literally like a god. She's like a goddess. And I'm like, whoa, slow your roll. Slow it down, because you're going to find out that this person is a human. And when you do, it's going to affect to some extent the way that you see that person. And we have to be very careful. But then I look at Michelle Obama, I think, launching her podcast this week and on it, and with Michelle Norris, who's fantastic, talking about this low grade depression that she's dealt with and how that got such an important conversation, but also how I almost felt like I did see some ridicule of it from the insane people on the right, like Christian national right. But I just felt bad in a way that her whole life is so on display. But I also felt good that she was able to talk about that. And I also thought that was a really good framing, low grade depression. And then in the end, maybe my most naive thought is, oh, well, wealthy people, celebrities, they should never. I do this all the time. What do they have to be depressed about? What does Michelle Obama have to be depressed about? So that was but what are your thoughts about all of what I just said about these Black women being under the microscope, including yourself, and then every once in a while having a flaw, admitting that flaw, and how it might get exploited? Yeah, well, and any conversation that includes me with those very esteemed women is one that I will have. Thank you. Part of it is, obviously rich people can have problems, right? I mean, look at Kanye, right? According to him, he's a billionaire, and yet he still is suffering from mental health issues. So, I think it was incredibly important for Michelle Obama. And what she was really saying is, yes, I may have this stature, I may have this platform, I may have this money, I may have this hot husband, all of those things. And so from the outside, he's hot. Don't do that. No, I was. It's all great, but she's still first and foremost a Black woman, which means that seeing people who look like her relatives dying in the street affects her. When President Obama said, Tamir Rice could have been my son or looks like my son or something like that, that was coming from a very authentic place. I think he said that about Trayvon Martin. Yes, I'm sorry. You're right. Yep. Yes. And so that was coming from a very authentic place. So, and you're absolutely right that it helps open up those discussions because
many people have the same initial thought that you do. Oh, well, if you're rich and privileged, how could you have a mental health issue? You know, how
it's the height of ignorance. Rich people commit suicide all the time.
That's
so,
right.
you know,
that's right.
Rich white men, right. And Anthony Bourdain just comes to mind. Yep. So sorry. I mean, I just, it's my own ignorance, but it's just something I sometimes.
You're absolutely right. You know, when I hear incredibly successful people talk about imposter syndrome, you know, like Roxane Gay, who is way up there in the upper echelon for me, you know, New York Times bestselling author and just badass Black woman and so many things. And, you know, and sometimes she says she feels insecure about things. That is revelatory.
Yes. And great
so
word.
I think that, you know, the First Lady saying that she is maybe experiencing, you know, low-grade depression, it's helpful because it says, you know what, despite all of these trappings that I have of success, I still struggle just like, you know, everyday people, everyday Americans, everyday Black women.
That's, yeah. I mean, if we're going to be on it, and let me just say this, if I don't even want to say it out loud, but if you're Michelle Obama, every day is a hard day just because you have to worry about the security and safety of your family. So that's, you know, that's got to be, I mean, we're all worried about the security and safety of our family every day, but you know, nobody's actively targeting my family. So, okay, now let's go to something lighter, a tweet of yours. Actually, you retweeted.
Oh, there are more? You should know that lightning rounds, I am so long-winded.
This one's easier.
This
one's easier.
Okay. All right.
Michelle Norris, you retweeted, who wrote and shared a picture. Just trust me on this. Spiced watermelon will change your life. It includes a picture of watermelon with some type of, it looks like black pepper. This was jarring for me. I don't like mixing sweet and salt, much less like anything sweet with anything spicy, and I don't like fruit having.
Listen, this is stereotypically the whitest thing you've ever said to me.
Why?
Yeah. Well, I don't like spice. That's basically.
No, I didn't say I don't like spice. I do like spice. I don't like them. I don't like. Yeah, maybe that's stereotypical too. But sweet and spice together, I don't.
Why not? So I mean, so what kind
I'm
of
entitled to my taste preferences. I'm terrified of this spiced watermelon idea. Seems. Okay. Have you had this? Are you blindly touting this, or have you actually had spiced watermelon?
I would be open to it. I would be open to spiced watermelon because I think that, you know, and I've learned a lot, mainly through cooking shows that I watch, like on Netflix or whatever. Chef Roy Choi, I want to shout him out because he's amazing. But you know, the sweet, the salt, the acid, and the heat, like, you know, and there's an actual book about that kind of thing. And like, you have to have all four of those in balance to have a really fantastic meal.
Don't tell me what I have to have.
Well, you can be imbalanced if you want to. But, you know, whether it's watermelon or a steak. And so I'm open to, you know, finding the umami in watermelon and other things.
By the way, the best thing about interviewing you is going through your Twitter timeline. Everybody should be following April on Twitter because it's up and down and all over the place. I get a really interesting perspective. I should do it every day because you tweet a lot and you have all these different things that you're talking about and tweeting about. You're really obviously great at social media. But let me now ask you, do you have, we're almost probably out of time here. Let me ask you just one more, though. I think is really important. I saw this last night. Oprah Winfrey erecting 26 billboards around Louisville saying that the police that are involved in the killing of Breonna Taylor need to be arrested with a website link on it. It's untilfreedom.com. 26 billboards, a billboard for every year of her life. Wow, that's a pretty interesting choice by her. I wonder how effective it will be. What is your reaction to Oprah buying and putting up all these billboards around Louisville where she was killed?
I know you hate the phrase, but I am here for anyone who is actively working for accountability for Breonna Taylor. I don't say justice because justice would mean that she would still be alive, but at least holding her killers accountable. I think that Oprah also put Breonna Taylor on the cover of her magazine and is the first time ever that Oprah has not been on the cover. That happened within the last week or so, I think. So I think that's great. We have been having, especially in the Black community, as monoliths that we are, the issue that Black women who are killed at the hands of state-sanctioned violence are not getting the same type of amplification and support that Black men are. So if you look at the dates, like I believe that Breonna Taylor and George Floyd were killed on the same day. Right.
Oh, were they really on the same day?
I think that's right. But if not, it was close. Again, I don't have Google in front of me, so I could be off. But within the same time period, at least. And so the fact that we're only talking about George Floyd, or, most of...
Well, there's a video of his death, I think, is probably...
Well, that shouldn't matter.
It shouldn't matter, but it is a thing that spreads...
Let's remember that Breonna Taylor was a healthcare worker, was a frontline employee. So that alone should give her status. Secondly, she was killed sleeping in her bed.
Her story, I think, is far more tragic in a way because of the fact that how she was killed and we could talk about the tactics that were used against George Floyd and undercover police in a no knock warrant.
Correct.
And she's in bed. And yes, what you just said, she's a healthcare worker. Yeah. So, comparing the two is important, I think. But I think the videos just seems to travel further faster. But
right. I get that, but we shouldn't have to. And I know we're out of time, but we need to have. There needs to be a larger conversation, not just you and me, about why it's necessary for video why people need video to be concerned about police brutality, right? Because you think about it, Trayvon Martin, there was no video for him. Right. George Floyd, there was Alton Sterling and so on. There's so many names out there.
And by the way, I always like to say I don't need any video. I have my own lived experience. I've gotten the crap kicked out of me by cops a couple of times. My brother has a couple. I think sometimes we forget. And I think it's important for white people, especially white men, to talk about their own experience. Like if it's been this bad for me with cops. And then obviously people, well, what did you do? What did you say? Believe me, it wasn't worth the ass kicking that we get. So it's really important just to mention that our own lived experience should matter to some extent too. I interrupted you. Now I feel bad, but I do want to ask you one final question, which is in your Twitter timeline. You seem to be obsessed with this actor. There's a lot of tweets dedicated
Daniel Kaluuya.
To Daniel Kaluuya.
Yes.
What is your obsession with this young man?
I'm not obsessed, but he
shared a lot of tweets about his work.
Including one. There are a lot of retweets.
Okay, I see him a lot in your Twitter timeline. Go ahead.
Oh my goodness, that's too much. Anyway, I think he is an amazing actor.
Okay.
Within 18 months, he was W'Kabi in Black Panther. He was the lead in Get Out, and he played the enforcer. Not even the villain, really. The villain was Brian Tyree Henry, but the enforcer. The bag man in Widows.
Yeah, I don't even know, but what is that show, Widows?
Widows is a movie starring Viola Davis, and it also had. Oh, what is that guy? Who's the guy that does all the Taken films?
Liam Neeson.
Neeson, yes. That is her husband. It's also the first movie role for Cynthia Erivo. And Daniel Kaluuya and Brian Tyree Henry are also in the film. Great film. You should absolutely see it.
Looks heavy. It looks heavy.
Yeah, well, it's good, and it's action. It's there was a gang of thieves or whatever, and they all get killed, and so their female partners, their wives and girlfriends, have to figure out how to get the money back to the bad guys in time. That's a really horrible synopsis of the premise. But that's basically what it is.
Well, I'll take anything on your recommendation, and it is good to see that Liam Neeson didn't get quote canceled after his comments about his feeling.
No one gets canceled, Pete. That's not a thing.
I know, but it's a hilarious thing to say, especially with Liam Neeson.
So Daniel is a great actor. And I think I saw Widows like at Sundance a couple of years ago. And then I was very privileged to be at a party with him. And he's just so, him and many, many other people, he's just so down to earth and humble, seems to be a great human. But his performance in Widows was something that will stay with me for the rest of my life. And very rarely do I say that. People
say a lot that I remind them of Liam Neeson.
Really? In what way? Because you will do anything to protect your daughters. I get that.
No one's ever said it.
Ever said that?
No one's ever said it. I just wanted to set you up.
I think that you are less problematic than Liam Neeson, so that's probably a good thing.
I just wanted to set you up for your honest reaction, and it was.
I was trying to listen.
No,
I'm gonna. How diplomatic.
I know, but I'm gonna edit it out for sure, and it's just gonna end in in what way? It was kind of like bless your heart. But I do see in Widows, it does star Colin Farrell, who I am 100% here for.
Oh, look at you. You've used it like 6 times, Mr. I don't like that phrase.
Yeah, I don't have a large vocabulary, but I would definitely spoon with him and let him tell me a story.
Wow.
I said it.
That's a lot.
I'm with
Speaking of telling you a story, my new thing is the Calm app. And I'm a freelancer, so I'm not repping anybody right now. But they have these stories. They have famous people reading you bedtime stories if you so choose.
No,
which has been lovely. Like last night, I listened to Lucy Liu, and a few nights ago, I invited Denai Guerrero from the Black Panther and many other things into my bedroom to read me a bedtime story. And let me tell you, it was a fantastic experience.
Okay.
Yeah.
Interesting. I had no idea that was. I'm trying to think of who I would choose. Male,
there are many
male
people.
or female.
I mean, Matthew McConaughey. Now, see, I don't invite white men into my bedroom, but if that is your thing, then
you've never. Hold on, you just admitted something. What's that about?
What
do you want to? You don't invite white men into your bedroom. Never have. You're saying you said that. I'm reacting to it.
I am saying with respect to the Calm app. There are many people
okay.
from whom you can choose.
Walk that back a little bit.
And my choices right now are women of color. Oh, and also LeVar Burton had one. His was good. And Clark Peters, who I know mostly from The Wire, but he's a fantastic character actor. He did a really good one, too.
I love it. I'm just going to say,
being able to go to sleep is hard for a lot of people right now. And so, it costs money. But if you have the financial privilege to be able to do it, maybe. You
started this conversation by talking about how scrupulous you are about folks and you don't like a lot of people. So I think that comment is in line with that. But because we're different that way, and I invite anyone in my bedroom, and I think the reaction generally is, oh, God bless you for showing up.
Oh, huh.
Oh, my God.
What does your wife say?
She is fine with it because she has a separate bedroom because of that.
I understand that marriages last longer that way.
No one has, by the way, no one has shown up. I've just invited.
But the invitation is there. Got it.
My wife is more like, can they cook?
There you go.
Thank you so much. Huh?
Fingers crossed for you that somebody's chosen.
Appreciate it. April, it's so good talking to you. I really appreciate you joining me always. I always love talking to you. And we got to do it again. And we've been flirting with the idea of inviting someone else into our conversation, specifically Jason Johnson.
Did Jason without me. What happened?
I don't know what happened. I
was the last one to send the email. He's the one that dropped the ball.
No, absolutely right. He's very inconsistent. He either gets right back to you or he doesn't get back to you.
6 months. Yep, yeah, and he's a great person. But, but he's been on MSNBC a lot more recently now. So maybe he doesn't have
back.
time.
We'll work it out. We'll figure it out. And I want to have more, conversations with a lot more people. So anybody you want to invite into the conversation, I'm happy to bring them into. So it all works. Thank you so much, April.
My pleasure. Anytime.
April Rain at Rain of April. Follow her. Tell her you heard her here on the show. A great, honest, heartfelt conversation with her. I love that. I hope you enjoyed that. I hope you enjoyed both those conversations. And thank you for supporting the podcast and listening and subscribing and whatever podcast app you're listening on. Please give it a rating and review. Those matter. And we need to get more subscribers here. Of course, like every media outlet does, this is independent media. It's not corporate media. I answer to you. So subscribe right now. Go to patreon.com/Pete Dominick or go to the paid subscription link in the show notes and sign up. so we can keep adding and building this community. All right, lots of really exciting guests coming up this week. Looking forward to getting a whole bunch of people on. I'm trying to get now 2 people on at a time more often. We'll see if I can make that happen this week. It ain't easy to schedule all this stuff and make it work technically, but I'm doing my best, and I appreciate your support and understanding when there's little problems here and there, because I'm doing it all alone. So thank you. I appreciate it, and I will talk to you right here tomorrow. No, you're not alone. I'm right there with you. Ups and downs, very normal, unprecedented times, crazy times, scary times, but let's stay together. Let's keep talking to each other. Let's stay connected. I love you. I'll talk to you tomorrow.